Hello, welcome to Thundercloud's Benefits at a Glance. The benefits we'll be going over will begin June 1st, 2023 through May 31st, 2024. The only time you will be able to make a change to your enrollment will be if you are experiencing a life event. A life event is when you are having a baby, a divorce, death of a spouse, death of a dependent, loss of dependent status. You will have only 30 days to make this life event change, and you will be required to submit documentation to support the change. We will be going over the benefits at a high level. Please remember that additional information can always be found on the Employee Navigator under Helpful Resources, or as well as the benefits you are enrolled in with the carriers. We have included on the front page instructions on how you can locate your medical provider, your dental provider, and a vision provider. You will have 3 Aetna plans to choose from. The first 2 plans, the Aetna AFA-OOAS 5000 and the AFA-OOAS 2750, use the same network. Aetna Select Open Access. The AFA CPOS plan uses the Choice POS 2 Open Access. Whichever plan you choose offers you preventative care at zero cost share, as well as using Minute Clinics at CVS with a zero cost share. All 3 plans will offer you a copay for your primary care, your specialist, emergency room, and urgent care. I do want to go over really quick what a copay is. Think of a copay when considering your plan. Please remember that a copay is a fixed amount you pay for a covered healthcare service. Usually when you receive the service, the amount may vary depending on the type of covered service. For example, primary care on the first plan is $40 and specialist is $80. A deductible. Remember, the deductible is the amount you owe for healthcare services before the health insurance begins to pay any portion. A co-insurance is just that. It's you share in the cost of a covered health service with Aetna. Deductibles are based on calendar year, which means they reset every January. And the out-of-pocket maximum is the most you will spend in a calendar year before the carrier is responsible for 100% of your care. All 3 plans offer you prescription drugs benefits with copays. We've included information on here on RX. Remember that Walmart's, Winn-Dixie's, some of the grocery stores, GoodRx offer you coupons and discounts. You can also ask your provider when he's prescribing you prescriptions if they've got any coupons or anything that could help you reduce the cost of your prescription drugs. Aetna website. We've included information for you to remind you how to log on to your Aetna website. Remember, there are several great benefits. They let you know when there's any changes, any perks that are going on. It will help you manage your benefits through seeing the cost share. You can see where you are in your deductible, your out-of-pocket maximum, what claims have been paid. We strongly suggest that everybody log on as well as download the mobile app. This tells you a little information about the ID card and how you should download and keep a copy of the digital ID card, as well as signing up for mobile. Aetna Minute Clinic. Minute Clinics are great because, one, they're at zero cost share for you. They can do a bunch of benefits at no cost, so they can check allergy symptoms, earaches, infection, gout, pink eye. These are just to name a few of the things that they can help you with. Aetna also offers you a virtual care solution at zero cost share, so you can call in and set up an appointment and do virtual care. Another great perk that Aetna is offering to all their members that are enrolled in the benefits. You would just have to follow the directions on how to log on. But members can earn up to $100 of over-the-counter health expenses. They put in about $25 every quarter. You can download to learn more about that on how to set it up. There's also, once you're logged in, you'll be able to download the catalog to see what uh, items that are over the counter you'll be able to receive your $25 discount. There is still CareFit, where you can log on. You can download the app. You can earn reward points. You can sign up for classes, show how you work out, earn different perks with that. Dental. Guardian will still be our dental of choice. You'll have two plans to choose from, a DHMO and a PPO plan. The DHMO, you will need to pick a provider. You can change your provider, but you will have to do that at the first of the month for the following month. The PPO plan offers you in and out of network benefits. The DHMO gives you fixed amounts, so you know exactly what it will cost when you go to have a certain procedure done. Under the PPO plan, you will have to meet a deductible. There is an out-of-pocket maximum, and there are co-insurances to a maximum $1,000. If you were to use your benefits, say on the PPO plan, just to go get your cleaning done, and it stayed under $500, Guardian will move roughly $350 if it's in network to your next year's benefits. You can track all of this information on your Guardian member portal. Under the DHMO plan, you have two cleanings in a 12-month period, as well as the PPO plan. There is in and out of network benefits, as I said, for the PPO plan, orthodontia, you have child and adult benefits, where under the PPO plan, you only have child. The fee schedule can be found on Employee Navigator, as well as additional benefit summaries through when you're logging in under the Helpful Resources tab. Vision. Your network is Davis Vision. You have a $10 copay to see a physician provider. There is in and out of network benefits, but as you can see, the allowances are slightly low. So we strongly suggest that everybody stay in network. You do get a $150 allowance plus 20% balance over anything that you purchase on a frames. There will be no additional discounts given at Costco, Walmart, Sam's Club, and there are some private practices, but that's because their frames have already been discounted. If you use VisionWorks, there is an extra $50 allowance to go to a VisionWorks. If you want contact lenses, there is a $150 allowance with the 15% over the balance. Again, no additional discounts given at Costco, Walmart, Sam's Club, and some private practices. You will also have out-of-network benefits if you would like to use out-of-network, but again, we say try and stay in network. You cannot get contact lenses and frames done in the same year. Frequency is you can have an examination every 12 months, lenses and contact lenses every 12 months, and frames every 12 months. Critical illness, there is a critical illness benefit that will pay you up to $10,000 in the event that you suffer a stroke, heart attack, Parkinson's, cancers, and there's way more. So over 30 major illnesses, you can find more of a benefit on the helpful resources under Employee Navigator. If you as the employee enroll in the benefit, you can select to have your children enrolled in a critical illness benefit at no additional cost to the children. The spouse is at a $5,000 benefit. There's an employee assistance program that's at no cost to you. You can have 6 visits for face-to-face video or telephonic counseling sessions. EAPs can help with financial help, legal services, online legal forms, child and parenting services, adult and elder care. Webinars and trainings can also be found on the website, as well as calling the phone number provided. Remember, EAP is done strictly confidential. Nobody knows that your employer or no one if you use the benefit. Life insurance, Thundercloud is providing all their full-time eligible employees with a one-time annual salary not to exceed $100,000 with AD&D. You also have the opportunity to enroll in voluntary life insurance. You will find more benefit information found on Employee Navigator under the helpful resources. But if you did not elect voluntary life at the time that you were first newly eligible or when this was presented, or you want to increase the life insurance benefits that you have on both you, your spouse, or child, you will need to complete evidence of insurability to see if they will consider increasing your amount. The EOI, which is the evidence of insurability, can also be found on Employee Navigator, and it's also done as a direct link to Guardian. Short-term disability is being provided to all full-time employees who are eligible. You get 60% up to $1,500 maximum weekly. Elimination period for injury is 8 days, for sickness is 8 days, and it's a 12-week benefit. Short-term disability will pay you in the event that you were to get sick or have an injury. We are also offering identity theft through LifeLock. If you've ever had your identity stolen, they will be able to help you. It's backed by $1 million policy. They will help you clear whatever charges or whatever has been taken as a theft. You will get notified through text messages, emails. There are 2 plans to choose from. Again, additional information will be found on Employee Navigator under the helpful resource section. Teleadvocacy, healthcare navigation, financial well-being, and pet care. These benefits that are being shown under My Benefits Work, you will receive all of these benefits for one low cost. You can see that there are several different benefits that are being offered to you at a discount. Part of the new benefits section is an all not right navigator. What they will to help you do is if you had questions regarding your bills that you get from the doctors, you don't understand it, they're highly trained and they can help you with your insurance benefits, provide guidance related to plan selection, explain care options, find highly rated doctors, analyze provider-based or experience some costs. All that is included. This is the this is the app that you can download for the My Benefits Work. Flexible spending. You have a benefit where you can put pre-tax dollars to pay towards your copays, your deductibles. It is a use it or lose it, so you want to be careful on how much you want to put in there. You do have a $500 carryover for the remaining balance into the next plan year as a benefit. There's a $5,000 dependent care as well. On Employee Navigator, you will also find what benefits can be used with your FSA money. There is a benefit called Beyond Med. This is if you would like to have things that are not covered by your health insurance. There is acupuncture, bariatric, chiropractic, dermatology, fertility, all these benefits. They have a department that you can call as a concierge. They can help you set up an appointment with one of their providers, or you can nominate a provider to see if they would like to be participating with Beyond Med medical plans. We will be doing enrollments through employeenavigator.com. If you're a first-time user, you will select register as a new user, create a username and password. It is case sensitive. It will ask you to provide the company identifier. That would be Thundercloud Management. It's just exactly how it's shown here. If you're a return user, you would put in your username. If you forgot your password, you would just hit forgot password and follow the prompts. Most people use their email address as their username. So if you forgot that, you can try your username email address. And again, if you forgot your password, then you would just follow the prompts on forgot password and reset your password. Please remember that all employees that are eligible for benefits must either enroll or decline in their benefits. There will be no automatic enrollment. So you will have to elect or decline each time. You will know that you have finished your enrollment process once you click on the agree button and submit to your benefits. You can find all of your compliance documents are also located on Employee Navigator. We have also included contact information for all benefits being offered. If you have any questions, please feel free to reach out to Colleen Hernandez at CGI Benefits or Debbie Rito at CGI Benefits, as well as Janelsa from Thundercloud's Human Resources. I want to thank you for taking the time to listen to the benefits at a glance.